Hello, I'm Dr. Samantha. I'm a naturopath that specializes in hormone health and fertility care, and today we're going to talk about fertility and your thyroid. So welcome back. If you haven't been to my channel or you haven't watched any videos yet, don't forget to hit subscribe. I come out with a new video every single Friday and we'd love to have you here. With that being said, let's talk about how the thyroid can impact fertility. So I know this is a topic that I feel like a lot of people are finally bringing up, but it's something that us naturopaths have loved to talk about for years. The thyroid is an organ that just impacts all our hormones in so many different ways. And today we're just going to talk about why it's so important that on your fertility journey that you get your thyroid checked and make sure that it is treated appropriately. So let's start. What is the thyroid? The thyroid gland is in your neck right here. It's kind of like a butterfly-shaped organ. It is actually stimulated by the pituitary, which is actually stimulated by the hypothalamus. Long story short, the hypothalamus tells the pituitary to secrete TSH. TSH then tells the thyroid to produce thyroid hormone, which is T4 and T3. That's a really simplistic breakdown. I think the important hormone here that most people talk about and hear about is TSH. That is actually short for thyroid stimulating hormone. So it does exactly that. It stimulates the thyroid and it is produced by the pituitary gland. So in the conventional world, TSH is looked at the most compared to the other thyroid hormones or other things that impact the thyroid. The theory is behind that is that the thyroid is essentially on a negative feedback loop. What does that mean? That means if there's enough T4 and T3 in the system, the body's going to tell the brain not to send any more TSH to the thyroid because we're all good on thyroid hormone. However, if your body needs more thyroid hormone and your thyroid's not able to keep up, the brain is going to tell the thyroid to produce more thyroid hormone, meaning it's going to increase the TSH, thyroid stimulating hormone. So when we get into like the nitty-gritty of like hypothyroidism versus hyperthyroidism, we're going to be talking about either an overactive thyroid or an underactive thyroid. An underactive thyroid or hypothyroidism is actually one of the most common things. Hyperthyroidism or overactive thyroid tends to be a little bit more rare. However, we're going to definitely talk about both of them today. So what is TSH going to look like if you have hypothyroidism? If you have hypothyroidism, that's going to show a elevated TSH because that is thyroid stimulating hormone. If your thyroid is not producing enough thyroid hormone, we want to send more TSH to increase the amount of thyroid hormone circulating throughout the system. The opposite goes for hyperthyroidism. So if you have hyperthyroidism, usually your TSH is on the low side. That's because you have a lot of thyroid hormone circulating in your system and your brain's telling your thyroid to slow on down. Now, what usually causes this? A lot of different things, right? At the end of the day, I'm gonna actually make this video probably 2 parts, but we could probably make this like a 10-part video for really wanting to get into the nitty-gritty of the thyroid. But I'm going to try to keep it general here for you today. Either way, if we have hypo or hyperthyroidism, we really want to do our best to create an optimal thyroid environment. So what are values that I, as a naturopath, like to get tested? I really like TSH to be evaluated, and I really like it under 2.5. We'll get into that a little bit more later about why I like that. I really like free T3 tested, free T4 tested, and then TPO antibodies, and then thyroglobulin antibodies. I find that the antibodies tend to be left off most panels, and I'm not really sure why because there's plenty of research out there that says it's super important, specifically when it comes to fertility. When we're talking about thyroid antibodies, they play a really big role in not only implantation, but it has been shown if thyroid antibodies are elevated at time of conception, it can increase risk of miscarriage, and there's been actually many studies done on that. So how do you know if you have hypo or hyperthyroidism? One, if you're getting a fertility workup, I would just in general request all of the labs that I talked about before to be ordered. I don't think it hurts anybody, and I think you can learn a lot of valuable information from it. So I'd highly suggest just getting them done. But if we're talking about symptomology, usually with hypo and hyper, they're gonna look actually kind of opposite. They have some symptoms that overlap, but most of the time, hypo means like under functioning or like sluggish and slow. So a lot of common symptoms are, fatigue, brittle nails, hair loss, weight gain, basically just thinking of everything slowing down, even constipation, irregular menstrual cycle. Hyperthyroidism is kind of the opposite. However, some people still notice that the hair loss and the hyper, but a lot of times there's like anxious feelings, insomnia, maybe loose stool instead of the constipation. So things that are speeding up. Hyperthyroidism can also impact the menstrual cycle and cause irregular menses. So symptoms can sometimes overlap, but usually with hyper, we're seeing things on the more active side, and hypo, we're seeing more underactive. Like I said, bottom line, I just feel like it's good to get the labs tested in general, whether or not, because a lot of people can have like a normal TSH and things are looking good, but they have elevated thyroid antibodies. And like I said earlier, that can be an issue and can increase risk for loss or miscarriage. So it is something that I would just recommend that you rule out and get checked. Now, why is thyroid so important for fertility care? I already listed a couple of reasons actually already. One, we want optimal health. So if our thyroid is not optimal, if we're in more of a disease state like hypo or hyperthyroidism, that always is going to cause an issue, right? It's the whole system. We need to treat the whole person. But as you can tell, there are other symptoms, right? We talked about how hypo and hyper can cause an irregular menstrual cycle. Having a regular menstrual cycle is essential when it comes to fertility. So at the end of the day, having optimal thyroid values are going to play such a big role in fertility care. Some important sensors that are needed for thyroid hormone to actually be created depend on estrogen levels. So if estrogen is out of whack or thyroid's out of whack, you can see how those can impact each other. I talked about TSH and the importance of it being under 2.5 earlier, or I just kind of stated that. So why is that? So I love this question because I think it's an amazing one, and I love when patients ask these types of things. So when we're talking about a developing fetus, thyroid has a big role in the beginning few weeks because baby doesn't have thyroid yet, right? Baby doesn't have that functioning, and we need our bodies to create and give baby thyroid hormone in order to create a healthy brain in baby. So as you can see, there's so many connecting pieces to thyroid and fertility. This is just the beginning. So this video is part 1. In part 2, I'm going to talk about possible treatment plans and what it's going to look like to get good care, as well as optimal versus normal values. Anyway, thank you so much for being here. I hope you learned something new today. Don't forget to hit that subscribe button. Give me a thumbs up if you like this video, and have a beautiful rest of your day.